All right, I see it's at the top of the hour. Let's go ahead and get started. Good morning and welcome to the Comagine Health weekly webinar series for long-term and post-acute care facilities to support the COVID-19 vaccine and booster rates. Thank you for spending time with us today. A few housekeeping items before we get started. Please take a moment to locate the chat feature in this webinar platform. It should be at the bottom of your screen. And feel free to share your thoughts, comments, and questions with all participants. Members of our team will be monitoring the chat and will bring your questions forward to our guest advisors during the Q&A portion at the end of today's session. Links to resources that the presenter shares will also be posted in chat throughout the webinar. Now that you've located the chat, we'd like to get to know you, our audience. If you're joining us from a care facility, would you please put your name and your facility's name and your role in the chat? A final reminder, this webinar is being recorded and the slide deck and recording will be available on the Comagine Health website following this event. And now I would like to introduce you to your presenter today, Carolyn Brill.
Thanks, London. Hi, everyone. I'm Carolyn Brill. I am a health IT consultant and senior improvement advisor with Comagine Health. During COVID over the last 2 years, I was able to participate in the Nursing Home Echo Series as a presenter for quality improvement. There were 2 groups in Washington, and I presented learnings with both the University of Washington medical research team and also the Comagine Health team. So I've been working on the COVID information for a while. And I have worked in healthcare systems and quality improvement for over 10 years. So that's a little bit about me. Today, we're going to cover this information, so I'll go through it. We're going to review a few points from the March 1st webinar about the booster schedule, which was also actually presented last Friday at the office hours. So this is going to be just a little review, then sharing a personal story. Then we're going to, my personal story, I chose it because it's really typical as it matches up with a lot of other stories that I have been researching. So we're going to talk about the terms hybrid immunity and fully vaccinated, and those definitions from the CDC website. And then there's a study recently published on March 2nd in the New England Journal of Medicine that I thought would help us see some data, and then what we can do to prioritize resident boosters, because that's one of the things that we're working towards. So that being said, that's what we're going to talk about. So I chose to go through these slides again because I had heard different things in the media about, eventually the booster dose is going to be considered part of the definition for fully vaccinated. So this slide, I think, originated on the March 1st presentation by Shannon Feingold and Tabitha Peterson. They're on the nursing home team, and they presented us a lot of resources. So if you missed that, that would be a really good slide deck to get because it has so many resources in it. That included referring to the series for immunocompromised people. That's what this is displaying, the 3 doses and then the booster dose. And this is the mRNA brand vaccines. So here's a view of that vaccine schedule. And I know we've seen it like 3 times if you're coming to all of these sessions, but these are the recommendations for immunocompromised. So the next slide shows us the non-immunocompromised individuals. And the reason I'm showing this slide is because this there's a couple of things that I want to talk about. So terminology is really important to me, and that topic of what's fully vaccinated has been discussed here and there. And I just kind of wanted to get to the bottom of it. What is fully vaccinated? And then what are we talking about? Are we talking fully vaccinated and boosted or what? So on the CDC website, and I think it's a recent change, they define fully vaccinated as a person who's received all the recommended doses in their primary series of COVID-19 vaccine. So when you're looking at this schedule and you see like Moderna or Pfizer, they have the first dose and the second dose. Johnson & Johnson's the first dose. So that's considered fully vaccinated. So if you're writing policies about vaccination, fully vaccinated, and you say fully vaccinated, that's what it means. On the CDC website, they have they call it up to date. So up to date means that the person has received all recommended doses in their primary series and a booster dose when eligible. So that, to me, is kind of like when we're talking about this, we have fully vaccinated and then up to date, and that's what being boosted is. So that helps me a lot in just conversations that I'm having with people. So I'm going to share a story that is a common story, and I'm using myself because I felt like it helps tie some of these things together. So I followed that schedule pretty much exactly like what was recommended at the time. I got the Moderna, vaccinated on 2/26 and then of 2021. I got the second vaccination exactly a month later, which was what was the recommendation was at the time. And then the booster pretty much on that same schedule. And when I got boosted, I was, according to the data and everything, between 80 and 90%, protected against Delta and 60 to 65% protected against Omicron. Okay, so the person who exposed us to COVID, they got their symptoms on January 29th, and they exposed us on January 30th. And that was 3 months after the booster. So we have a chart that I'm going to come back and refer to that. Our symptoms began on February 2nd. So we have 3 people in our household that were exposed, and only 2 of us got COVID. 1 person did not get it. My husband, who's 65 years old, did not get COVID. And we had those home tests, so we were testing him frequently because I kept thinking, you have asymptomatic COVID, and I want to see if you have it. And so he just never tested positive on that. And we even took him in for a test at the clinic, and he did not have it. My daughter and I, we did not lose our taste or smell. We had mild symptoms compared to what the symptoms, people obviously been dying. So when we talk about mild symptoms, we still suffered, with headache, fever, tiredness, all of those things. And the tiredness lingered on. So the duration was about 1 to 2 weeks, but really our symptoms were just a couple of days. And this kind of goes along with what a lot of people are describing on the internet and, of how, their Omicron experience had been. And the reason I'm saying Omicron is I believe because of the short amount of time that it took us to get symptoms after exposure, that falls in line really with everything that we know about Omicron. So what I also thought interesting was, my daughter is 19 years old, and she probably experienced the same or worse symptoms than I did. And it's just people say, well, the younger people don't experience it as much as the older people, and I just think that it's really a very individual experience, and it's unknown, and that's why a lot of people don't want to get COVID. So I wanted to know more about what my immunity is moving forward after COVID. I assumed from everything I heard in the media, I said, oh, I have hybrid immunity. I'm a super person now. I can go anywhere and do anything for at least a couple of weeks and not worry about COVID. But as I did research, I found out, well, no, I don't have hybrid immunity, because hybrid immunity is when you have COVID-19 infection and then you get the vaccine. I had what was called breakthrough immunity, which means I was vaccinated and then got COVID as a secondary thing. And I think they are, they're similar, but they have differences. So I'm just going to play you a short video that kind of talks about the differences between hybrid immunity and breakthrough immunity. It's a little newscast, and it's 2 minutes. It's pretty current, because the breakthrough immunity is very, very new. So here we go.
And we wanted to know, what about people who've been vaccinated and had an infection? Do they need a booster? ABC 10 News anchor Derek Stahl is going in depth on the emerging science.
There are two categories of people who have had both a vaccine and a COVID infection. Cases where someone got the vaccine first and then got infected are called breakthrough infections. Someone who got infected first and then got vaccinated has what's called hybrid immunity. When it comes to the question of boosters, we know a lot about hybrid immunity and a lot less about breakthroughs, says immunologist Dr. Alessandro Setti.
If someone was infected and then gets vaccinated, they have a very strong immune response that often exceeds what is seen either in natural infection or following vaccinations.
Dr. Setti's lab at the La Jolla Institute for Immunology and several others have shown that people with hybrid immunity have exceptionally strong protection, with 25 times more antibodies than vaccination alone and 100 times more antibodies than infection alone. It's all because the vaccine looks like a repeat visit from the virus.
The first time around, the immune system say, okay, fine, there was something that probably eliminated it. And then it comes back a second time. The immune system says, oh, I maybe should really start to pay attention, because whatever I did, it didn't do the trick.
He says for most people with hybrid immunity, a booster is probably not necessary. Although a study out this week showed it will still elevate your antibody levels. And that might be helpful, especially for people at high risk. But what about people who got vaccinated and then infected, so-called breakthroughs?
It may very well be that the breakthrough infection has acted as its own booster, if you wish, but we don't know that.
Dr. Setti says breakthroughs might operate like hybrid immunity, but they're still running the experiments, and there are theoretical reasons why the two might be different.
It could be that someone that has breakthrough infection didn't have as much of a good, strong immune response in the first place.
A preprint released Thursday looked at people who had breakthroughs in the Provincetown outbreak. They found those with breakthroughs had a 34-fold jump in antibody levels. That's a bigger jump than you get from a booster. But as we wait for more research, doctors say at this point, people who had a breakthrough should follow the same booster recommendations as everyone else. Derek Stahl, ABC 10 News.
Now, the CDC hasn't issued any official guidance on boosters in people with breakthroughs. However, the agency says you should wait until you recover from an infection before getting a shot.
Okay, so I thought that would kind of kind of shows you that I know that in the provider was not committing to saying that you should get the booster exactly, but hinting that even if you get COVID after you're vaccinated, a booster is still going to be helpful, because it's really unknown how much immunity that you're going to have after that. It's not, I mean, it is measurable, but most people are not getting measured, so the next thing that I think that will help us think about the booster is the New England Journal of Medicine study that was published on March 2nd. And this is the most recent study that I could find that included Omicron. So there's a lot of studies that I've been reading about, Delta and the original COVID strain, but not a lot of research has been published on the Omicron. And this study, let's see, I'll just kind of explain. The title of it is COVID-19 Vaccine Effectiveness Against Omicron Variant. And it was done to estimate, vaccine effectiveness against symptomatic disease caused by Omicron and Delta. So it kind of compared Delta and Omicron to kind of give you that view. The subjects were tested between November 27th, 2021 and January 12th, 2022. The conclusion was that a Pfizer or Moderna booster after Johnson & Johnson or Pfizer or Moderna primary course substantially increased protection, but that the protection waned over time. And that got me thinking about my own infection, that what happened to me. What was my effectiveness potentially at the time when I contracted COVID, having been fully vaccinated and up to date. So this, I don't know if I mentioned it, was about 2 million people in this study in the UK. And so you have seen a lot of charts like this, I think, in past presentations, probably not this exact one, but I want you to look at this chart in the middle section B, and that's the Pfizer section. So this is like Johnson & Johnson at the top, then Pfizer, then Moderna. And the bottom of the chart shows the weeks, like 2 to 4, 5 to 9, 10 to 14. The square dots represent Delta and the round ones represent Omicron. And just notice how the effectiveness reduces over time. So when I look at this and having been boosted, I see that my effectiveness of my vaccinations was roughly between 30 and 40% at the time when I contracted COVID. And I think that has a lot to do also with your immune system. So, like, for example, like the person in our household who did not contract COVID, had the same exact exposure and everything else, but probably had a much stronger immune system. And, that could explain why that they didn't get it. But, so the shaded section, is your regular doses. And then you get to the white section for the booster. It's that first section is actually the Pfizer booster. But when I look at the primary course, I mean, you see that your effectiveness is after 25 weeks between 0 and 10% for Omicron. And I thought this was really compelling because even though your Delta protection is higher, it's now no longer the primary variant in our country. So I just wanted to point that out and talk about it a little bit. Protecting, all these vaccines wane over time. And I think that that's important to point out to people. So after my, let's see, sorry. So after my booster, that brings you back up to almost 65% initially. And so I just think that keeping that in mind, and presenting this information to you, I know it's been presented to you. I feel like I'm, trying to convince you that the booster is good, even though I feel like everyone on this call is already convinced. So it's kind of like, how are we going to convince everyone else, that to do that? And I think that that's where the hurdle is. So the studies all conclude that the booster is recommended for the best protection, along with keeping your immune system healthy. Everyone here today is in agreement, that a booster can help residents and staff. But I think what we need to talk about a little bit is like, what are your barriers? When we did the echo sessions on COVID initially with nursing homes, each nursing home seemed to have different hurdles and different barriers. And I loved it because the nursing homes helped each other by sharing their stories and helping each other get through those hurdles. And our nursing home team also has experienced that. And so they have a vast wealth of experience doing that. But we used our time talking about barriers such as corporate policies that were not updated and did not, include the booster, transportation, power of attorney for residents not being local and sometimes difficult to communicate with, some staff spreading misinformation, and then in keeping and easily accessing records that people need to know where people are at in their series. So even though the booster's recommended, how are we advocating for the booster? Is everyone on the same page with like the importance of the booster, and how is that being communicated? So do you have any signage about that? Does everybody have consistent information about policies? And then on this slide, I listed, staff, contracted staff, resident, consultant, visitor. And, I know that these are all a little bit different in how you approach that communication. I'm going to go to the next slide, where the vaccination process for boosters, again, talking about what is your process. And so that's something that we, being the quality improvement for, our state, many states, that is our bread and butter. That is what we do, is we help work on processes, remove barriers, bring information needed. I mean, do you still have a partnership with a pharmacy? Do you have a way to facilitate appointments? And is there a difference between being fully vaccinated and being up to date? Does your organization require people or staff members to be up to date? Is that optional? What does like what is happening and how much time are you able to spend on it? Can you help with transportation? Can staff be vaccinated during work hours still? And how effective is the communication with the residents' POAs, or like if the residents aren't making the decision for themselves, are they working through their provider? How is that being conducted? And so in this presentation, and I'm not going to go into any detail of solutions because there's so many different barriers that you could be having. But I wanted to put a plug in for our nursing home team because they are so good at this work. And I'm going to then put their contact information up. And I love working with this team. They are so dedicated, highly motivated to assist with whatever they can. And please be sure to reach out to them and get your booster plan in place. Thank you very much. We want to run the, or we want to do questions. Any comments?
Marisol, I noticed you said your goal is to have 75% of your staff boosted. Would you mind sharing with us some of your biggest obstacles to reaching that goal?
Yes, hi, this is Marisol. Yeah, I was actually going to comment about that because my personal feeling is that right now that like the cases are going down, like especially in our county, the numbers are going down, and in our state, I just have a feeling that the staff are not going to pursue getting their their booster. So that makes it difficult too, where they're like seeing, that the cases are going away. So what's the point of them getting vaccinated? And also because we are in a small town, very rural, we don't have as much access like in the bigger cities where they have CVS or Walgreens or Walmart, where you can just walk in or make an appointment, that kind of stuff. So it is very limited in us getting vaccines. So that is a challenge.
Thank you for sharing that. So it sounds like you're having access issues, but you're also concerned that the uptake from your staff might be lowered because the numbers are declining.
Yes.
Mm-hmm.
And I was also one of those that got vaccinated with my booster December 28th of this last year, and I got sick January 21st with COVID. So there again, it's just because they, especially the CNAs, they see that kind of stuff, or like, well, what's the point of me getting boosted if you still get sick?
Right.
But they don't understand, and we try to tell them and explain, well, it's not, that you can't get sick. It's just, it'll help the severity of the disease. And so we do post signs of like when the Quad County comes out and does vaccines for us at a place here at the Lyon County Fairgrounds. We just try to put notices for them to let them know when they can get a vaccine if they are still interested in it.
Marisol, this is Tabitha. I'm one of the improvement advisors on the nursing home team, and I'm based in Las Vegas. I'm wondering, I feel like I recognize your name, and we've not talked before though, but I think I've seen you on some of these calls. Did we send you resources on there? We have access to a couple of videos where folks, physicians describe why it's important to get a booster.
Yeah.
Did we send
I had gotten those from Donna Thorsten.
Okay.
Yeah.
Okay. Did you have, what did you think of them? Do you think, are they things you share with your staff or?
Well, they were helpful to me, but I did explain to Donna Thorsten that I feel like I have a lot of pressure on my shoulders because my infection control nurse is not vaccinated. And I don't know if it's that she doesn't believe in the vaccine, but it just puts more pressure on me as a leader here in long-term care, where you usually have that infection control nurse to help you do the education, to help you encourage the staff. So it's like I have more work now because I feel like she doesn't believe in the vaccine. I asked her why she's not vaccinated, and her response is because she doesn't like needles, which I know is not true. She's just coming up with something,
Yeah.
So it is challenging on my end because I already have a plate full of stuff to do, and on top of trying to do her job of educating and encouraging them to get vaccinated is a lot.
It is a lot. It is a lot.
So we are currently looking at getting a different infection control nurse, and I think she's going to be starting next month. So
yeah, it's really hard to make a dent in a movement like the COVID vaccines when the person doing the work doesn't believe in it.
Yeah, exactly.
So yeah, because I think a lot of it, what we've heard from other nursing homes is a lot of it is about, sharing personal experience, right? Like Carolyn
Yeah.
did today,
Yeah. Yeah.
and why it was important for me to get the vaccine, and why, why I believe it's,
Yes.
it's valuable. And if she's not able to do that, and she's supposed to be
Yeah.
the voice of it,
Yeah.
that's you're definitely doing some hard work over there.
Yeah.
Thank you for continuing to do it.
Yeah.
Marisol, did you ever receive, there's a link that we have for people who are fear of needles. You mentioned somebody that had that. Did you ever receive a link to that resource?
Yes, I think so. But like I said, to be honest, I don't think that's her actual reason why she doesn't want the vaccine, because she made a few comments later on about some nurse that had gotten the vaccine and died. And so I know that she is anti-vaccine.
Okay.
Did anybody else have any thoughts or questions, comments that they wanted to share? Any tips for Marisol if she's filling? I do have a poll for us. If you wouldn't mind just sharing with us how you felt about today's presentation. It helps us to improve as we continue. And then Carolyn, do you want to leave the PowerPoint up for just a minute? I think we
Yeah, I was trying to stop sharing, but I can.
Thank you so much for sharing your feedback with us in the poll. Thank you so much for presenting, Carolyn. That was great. I think that's the end of our presentation today, and I look forward to seeing you next week. Thank you, everybody.
Thank you.